Another day, another story. Fibroid diet. A fibroid diet generally involves eating a healthy, balanced diet that's high in nutrients and low in processed foods, saturated fats, and red meat. Here are some dietary recommendations that may help to alleviate the symptoms of fibroids. Increase fiber intake. Eating a diet that's high in fiber can help to regulate estrogen levels and reduce the risk of developing fibroids. Fiber-rich foods include fruits, vegetables, whole grains, and legumes. Limit red meat. Eating a diet that's high in red meat has been associated with an increased risk of developing fibroids, so it's recommended to limit red meat intake or opt for leaner sources of protein such as chicken, fish, or plant-based protein sources. Choose anti-inflammatory foods. Inflammation can contribute to the development and severity of fibroids, so eating a diet that's high in anti-inflammatory foods such as leafy greens, berries, nuts, and fatty fish may help to reduce inflammation. Avoid processed foods. Processed foods can be high in sugar and unhealthy fats, which can contribute to the development and severity of fibroids. It's recommended to avoid or limit processed foods and opt for whole, nutrient-dense foods instead. Choose organic foods. Eating organic fruits and vegetables can help to reduce exposure to pesticides and other chemicals that may contribute to the development of fibroids. Stay hydrated. Drinking plenty of water can help to flush toxins out of the body and reduce the risk of developing fibroids. Fibroid herbal remedies. Herbal remedies are sometimes used as a natural approach to managing fibroids, although it's important to note that scientific evidence for their effectiveness is limited. Here are some common herbal remedies that have been used to manage fibroids. Chasteberry, also known as Vitex. Chasteberry is an herb that's commonly used to balance hormone levels and reduce the size of fibroids. Dong Qi. Dong Qi is an herb that's often used in traditional Chinese medicine to manage menstrual irregularities, including those caused by fibroids. Red raspberry leaf. Red raspberry leaf is a herb that's commonly used to support uterine health and balance hormones, which may help to reduce the severity of fibroids. Milk thistle. Milk thistle is a herb that's commonly used to support liver health, which may help to reduce inflammation and promote hormonal balance. Black cohosh. Black cohosh is an herb that's commonly used to manage symptoms of menopause, but it's also been used to reduce the severity of fibroids. Turmeric. Turmeric is a spice that's commonly used to reduce inflammation, which may help to alleviate symptoms of fibroids. Fibroid specialist. A fibroid specialist is a healthcare provider who specializes in the diagnosis and treatment of fibroids. Fibroid specialists may include gynecologists. Gynecologists are healthcare providers who specialize in the female reproductive system, and they are often the first healthcare providers to diagnose and manage fibroids. Reproductive endocrinologists. Reproductive endocrinologists are gynecologists who specialize in fertility and hormonal disorders. They may be consulted for fibroids that are affecting fertility or causing hormonal imbalances. Interventional radiologists. Interventional radiologists are healthcare providers who use imaging technology to guide minimally invasive procedures, such as uterine fibroid embolization, UFE, or MRI-guided focused ultrasound surgery, FUS, to treat fibroids. Obstetricians. Obstetricians are healthcare providers who specialize in pregnancy and childbirth. They may be consulted for fibroids that are affecting pregnancy or causing complications during childbirth. Gynecologic oncologists. Gynecologic oncologists are healthcare providers who specialize in the diagnosis and treatment of gynecologic cancers. They may be consulted for fibroids that are causing unusual symptoms or have the potential to become cancerous. When seeking a fibroid specialist, it's important to consider their experience and expertise in managing fibroids. It may be helpful to ask for recommendations from other healthcare providers or to seek out specialists who are affiliated with reputable medical centers. Living with fibroids. Living with fibroids can be challenging, but there are strategies that can help manage symptoms and improve quality of life. Here are some tips for living with fibroids. Stay informed. Learn as much as you can about fibroids, including their symptoms, causes, and treatment options. This can help you make informed decisions about your healthcare and feel more in control of your condition. Manage symptoms. Symptoms of fibroids can be managed with pain relievers, hormonal treatments, or other medications. Heat therapy, such as using a heating pad, can also be helpful for relieving pain and discomfort. Practice self-care. Self-care practices such as getting enough sleep, exercising regularly, and eating a healthy diet can help manage fibroid symptoms and improve overall well-being. Seek support. Joining a support group or seeking out therapy can provide emotional support and help manage the stress and anxiety that can come with living with fibroids. Consider treatment options. If fibroids are causing significant symptoms or impacting your quality of life, it may be time to consider treatment options such as surgery or minimally invasive procedures like uterine fibroid embolization or MRI-guided focused ultrasound surgery. It's important to work with a healthcare provider who understands your individual needs and can help you develop a personalized treatment plan. With the right management and support, it's possible to live well with fibroids.